Hey guys, my name is Ashley Mortimer, and this is Talia. And today we're going to be talking a little bit about botulism. Now, if you're anything like me, the only thing that I ever really knew about botulism is that if you give honey to an infant, like Talia, who's under the age of 1, that it will give them botulism. But I never really knew what that was. So hopefully by the end of today's presentation, you'll have a better understanding of what botulism is. First, we're going to talk about the etiology of botulism. The correct name for the bacteria that causes botulism is Clostridium botulinum. It's a gram-positive bacteria in the bacillus or rod shape. It's also a motile bacteria, and it has the ability to produce the neurotoxin botulinum, which is actually the most potent toxin known to all mankind. As well, human botulism is actually caused by 4 of the recognized types of Clostridium botulinum. So it's a group of bacteria that cause botulism. Clostridium botulinum is a bacterium that forms spores, which are small, single-celled bodies capable of growing into new organisms. These spores can survive in most environments and are actually very hard to kill. They can survive the temperatures of boiling water. So when foods are canned, they're actually processed at a temperature even higher than the normal boiling point so that they can kill those spores. As well, the growth of the bacterium can be prevented by high acidity, a high ratio of dissolved sugars, high levels of oxygen, very low levels of moisture, or storage at temperatures below 3 degrees Celsius, which is 38 degrees Fahrenheit. So just some examples for this to kind of get a better picture of it. In low-acid canned vegetables, such as green beans, that are not heated enough to kill the spores, it may provide an oxygen-free medium for the spores to grow and produce the toxin. But in another vegetable like pickles, where there is sufficient acid to prevent growth, no danger is going to be there. Other things like honey and corn syrup may contain some of the spores, but these spores cannot grow in a highly concentrated sugar solution. However, if the sweetener, like honey, is given to an infant, and the infant still is under the age of 1 and has that low acid digestive system, then the spores can grow and produce toxin.
C. botulinum spores are naturally found in soil, aquatic sediments, the intestinal tract of birds, animals, and fish, agricultural products, including honey and vegetables.
Next, we're going to talk about some of the signs and symptoms associated with botulism. First off, there's 3 different types of botulism that include foodborne botulism, wound botulism, and infant botulism. And there's a few symptoms that are common with each of these kinds of botulism. So difficulty swallowing or speaking. With infants, that's going to be more manifest in difficulty sucking or feeding. Paralysis. It might not always be that extreme. That might also be manifest just with flaccid or limp muscles. And then drooping eyelids. Common to both foodborne botulism and wound botulism are facial weakness on both sides of the face, blurred or double vision, and trouble breathing. As well, with foodborne botulism, you might experience dry mouth, nausea, vomiting, and abdominal cramps. And with infant botulism, the baby might experience constipation. That's actually one of the first symptoms that it's usually manifest. Floppy movements due to muscle weakness and trouble controlling the head, a weak cry, irritability, drooling, and tiredness. As far as the transmission of botulism, botulism develops if a person ingests a toxin. So it's not spread from person to person, but from certain things that you might eat. The foods that are most commonly associated with botulism include inadequately home-canned foods with low acid content, such as asparagus, green beans, beets, and corn, as well as lightly preserved foods such as fermented, salted, or smoked fish and meat products. And then specifically for infants, honey and corn syrup. So you might be wondering, why are just infants at risk if they have some honey? Well, this is because adults and children that are over 1 year old their body has gotten a natural defense that develops over time to prevent the growth of the botulism spores. But because infants have not yet developed these natural defenses, The spores grow in the infant's gut and then produce the bacteria that release the toxin. We also talked about wound botulism. So that can occur when the spores get into an open wound and are able to reproduce. So a lot of times this can happen from contamination of wounds by soil, gravel, or any improperly treated open wounds. But it's most common with the use of injectable street drugs.
Botulism is not contagious, so it cannot be spread from one person to another. If you're diagnosed early with foodborne or wound botulism, an injected antitoxin reduces the risk of complications. The antitoxin attaches itself to the toxin that's still circulating in your bloodstream and keeps it from harming your nerves. The antitoxin cannot reverse the damage that's been done, but fortunately nerves do regenerate. Many people recover fully, but it may take months and extended rehabilitation therapy. A different type of antitoxin, known as botulism immune globulin, is used to treat infants. For cases of foodborne botulism, doctors sometimes clear out the digestive system by inducing vomiting and giving medications to induce bowel movements. If you have botulism in a wound, a doctor may need to remove infected tissue surgically. Antibiotics are recommended for the treatment of wound botulism. However, these medications are not advised for other types of botulism because they can hasten the release of the toxins. If you're having trouble breathing, you will probably need a mechanical ventilator for up to several weeks as the effects of the toxin gradually lessen. You may also need therapy to improve your speech, swallowing, and other functions affected by the disease. There is no medicine to prevent botulism. There is an investigational vaccine that is available only to laboratory people working with Clostridium botulinum, or the toxin. So the ways we can prevent is to be sure to use proper techniques when canning foods at home to ensure that any botulism germs in the food are destroyed. Also consider boiling these foods for 10 minutes before serving them. Discard foods after the expiration date or if a food can is swollen, rusty, or damaged. If you wrap potatoes in foil before baking, eat them hot or store them in the refrigerator. Do not keep at room temperature. Store oils infused with garlic or herbs in the refrigerator. Do not give infants younger than 12 months honey, corn syrup, or undercooked foods. To prevent wound botulism and other serious bloodborne diseases, never inject street drugs. You might wonder how something so toxic could ever be beneficial, but scientists have found that the paralyzing effect of botulinum toxin makes it useful in certain circumstances. Its brand name, more commonly known as Botox, was initially intended to stop muscle spasms around the eye. It is one of the most effective treatments for the blepharospasm. Its cosmetic application only came to light as a side effect and has been used to reduce facial wrinkles by preventing contraction of muscles beneath the skin. Botox is FDA approved for treating excessive sweating of the underarms. Botox works by preventing the release of a chemical that signals the sweat glands to activate. You may need to have several Botox injections, but the results can last for almost a year. However, there have been rare occurrences of serious side effects, such as muscle paralysis extending beyond the treated area, with the use of botulinum toxin for medical reasons and cosmetic procedures. Hi, my name is Sophia Dunn. Ashley and I have enjoyed learning and studying this topic and presenting it to you today, and we hope you have learned something new about botulism. Have a great day. Bye.
Bye.